Hey guys, and welcome to the LoveMeSculptingSpa YouTube channel. My name is Lexi, and this video will be about my client who's getting a post-op massage done by me. Here's just a little information that you can read about myself. Hope that you can enjoy it and enjoy this video. Be sure to like, share, and subscribe for more. Hey guys, and welcome to another LoveMeSculptingSpa video. This video is going to be how I take care of my post-op clients when they have either tummy tuck or liposuction. As you can see in the beginning of this video, I am taking off her bandages so that we can get started on her process. And what I'm going to do is take off the bandages under her boobs just to make sure that there's no openings, and then I'm going to check around her waist for the same thing. And after I'm done that, then I will begin her treatment. So now I'm going to begin her treatment. As my client was only 10 days post-op here, I had to do ultrasound therapy to break down the inflammation that she had before I started her massage. I touched the areas to see where the swelling was, and what I'm going to do first is apply some ultrasound gel, and then I am going to use I'm going to check to make sure that it's not too hot on my client's skin, and then I'm going to use my ultrasound machine for about 15 minutes and just rub it along her back, her sides, and everywhere that has swelling, so you guys can enjoy this part of the video. Treatment, I will begin her manual lymphatic drainage, starting with her neck area, opening up her lymph nodes, then going towards her chest area. From there, I will then go towards her armpit area, and that's where we will begin to open up her lymph nodes. By doing that, it will make her drainage process a lot easier, and she will be able to recover a lot faster. So as you guys can see here, again, I'm just massaging the neck area towards the armpit and pushing towards, again, from the chest towards the armpit to the lymph nodes so that it can drain. Then begin here to do her massage. I gotta sit down and get a little comfortable because sometimes standing on my feet all day does get a little tiring and swollen. So as you guys can see, I'm massaging the sides and I'm going forward and upwards, forward and upwards. You wanna move the fluid away from the swelling and towards the lymph node so that it can drain. Yes, my clients always want to have that nice contour look, but they cannot have the contour look if I do not drain. So usually the treatments go for about an hour and 15 minutes to 20 minutes. But when my clients are freshly post-op, I like to take my time on them and give them about an hour and 45 minutes to almost 2 hours so that we can really get rid of as much fluid as possible, because sometimes my clients are coming from far, have to drive an hour 2 hours away to just come for their appointment, just because they want a massage with me, because they know I'm going to give them exactly what they're looking for and give them the relaxation that they need and get rid of the inflammation that they have. So with that being said, I like to return the favor of them traveling so far with a great service. Post-op care, lymphatic drainage, body sculpting, never rush the process, because when you rush the process, you rush the results, and you don't get what you need, and then you might come into complications. So that is why I take my time with my clients and I give them exactly what they're looking for. So now we'll talk about the drainage process that I do on my clients. Sometimes my clients come overseas with this drain inside of them. So I pray a lot of times that they don't, but when they do, it is what it is. I gotta do my part. It's really simple. I just make sure that there isn't any more fluid coming out through the drains at a certain amount of cc's, right? Whether it's from the stomach or even in the arms. I'm doing a drainage removal here as well. And once it's under a certain amount of cc levels, then it's time to just take out the drain. So what do? I cut the stitch, make sure the area is clean, nothing's blocking, and I just tell my client to breathe in 3 seconds, and I just pull out the tube. So you guys are gonna see here that I cut the stitch and then the drain just goes. Usually once you take the tube out, people think, oh my god, there's a hole in my arm. No, usually I'll just apply a powder. The client usually has this recovery powder when they come from getting their surgery, and you just keep applying it onto the wound, and it will naturally just close and heal the wound perfectly, and it will avoid any infection. You cover it for a few days in case it is leaking, and then once it stops leaking and it's dry, you uncover it and you just let it air dry and let it be free. And you just apply that same powder, and that powder will dry up the wound and heal it. Next, we'll get into the seroma drainage. So sometimes when you take the drains out, 2 things can happen. You could take the drain out too early and then your client can get a seroma, or you could take the drain out because your client is not draining at all, and over time they just retain a lot of fluid, and you just have to you just have to drain out that fluid, which is called a seroma. So that is what I'm doing now. I usually just take a needle where I see the pocket of fluid, and I put the needle through the fluid. It will then pierce the fluid will then push out, and all I have to do is massage my client's tummy or wherever the seroma is and push the fluid out. My client usually feels 10 times lighter, 10 times better, and they don't feel that tightness that was restricting them before the seroma appeared. So as you guys can see here, I just massage and push, massage and push, massage and push. And you would think, oh, that little hole, there's not a lot that's coming out of there. But in this video, you can actually see how her stomach gets smaller while getting the drainage. And here are the end results of my clients' massages. Be sure to shop and book LoveMeSculptingSpa.com.